Afternoon and evening to everyone, wherever you're joining us from. Welcome to this critical webinar hosted by the Coalition for Global Health Innovation and the IVPN network. My name is Charlie Sitong Zhang. I'm the president of CGHI, and I will be your moderator for today's webinar. First of all, we are greatly grateful for each one of you for joining us today to discuss the pressing health and humanitarian crises currently unfolding in Sudan and Gaza. As we come together, we are reminded of the urgency and gravity of the situations in these regions. Our agenda today is filled with insights from our esteemed experts who will provide a comprehensive understanding of the challenges faced and explore potential pathways unfold. We will begin with our examination of the conflict in Sudan. Dr. Mazin Elmubarak will offer an overview of the war's impact on the health system. Next, Dr. Faihaa Dafalla will address the major challenges and obstacles in maintaining and improving health services during the conflict. Dr. Mohammed Yusuf will then provide strategies for navigating this health crisis and overcoming the significant obstacles that hinder the effective health interventions. In the second half of our webinar, we will turn to Gaza. Ms. Hala Redwan and also Saja, Ms. Saja will share their insights from working with marginalized communities in the region. And then Mrs. Nour Arnaout will offer insights into the digital health and health systems strengthening in Gaza. Each round of presentations will be followed by a Q&A session where you will have the opportunity to engage directly with our speakers. We will also have a general discussion towards the end, which we hope will foster collective thinking and to discuss this urgent humanitarian crisis together. So thank you once again for your presence. Let us now proceed by welcoming our, actually I'm gonna invite Rafa to say something about the IVPN network. Over to you, Rafa.
Thank you, Charlie. Good morning, good afternoon, good evening, everyone, everywhere. This is Rafa Khalifa, and on behalf of the IVPN network, I thank you for joining us today for this critical discussion on addressing health crises in MENA conflict zones. It's a privilege to welcome all of you to this webinar, which marks a vital collaboration between the IVPN and CGHI, aimed at tackling severe health challenges in some of the world's most fragile regions. There is no doubt that the ongoing conflicts in the Middle East have adversely affected public health, with millions of people suffering from inadequate health care and ongoing instability becoming unfortunate constants for many. IVPN's mission is to address global health issues through volunteerism and innovation by leveraging its capabilities, international audience, and the expertise of passionate professionals. The webinar is a testament to this mission. We are joining forces with CGHI in order to find sustainable solutions to the complex healthcare system issues burdening conflict zones in the MENA region. As our speakers today bring a wealth of knowledge and on-the-ground experience, I invite all of you to participate actively in the discussion, seek out solutions, and ask questions in an effort to inspire coordinated action in order to build resilient healthcare systems and save lives, most importantly. Thank you once again for being here today and for your commitment to global health. I look forward to a fruitful and impactful discussion. The floor is again yours, Charlie. Thank you so much.
Thank you, Rafa. So I will also give a quick introduction of CGHI. So We are the Coalition for Global Health Innovation. We are a community of young professionals and students in global health and development. We come together from 6 different continents, from very multicultural and multidisciplinary background. And we organize webinars like this one. We organize online events, and we also publish articles and blogs on the urgent global health topics. And we also have a pre-incubator styled program where we help young professionals to build their projects. So I would like to encourage you to find us on LinkedIn, on Instagram, on YouTube. So let's stay connected. So now I would like to introduce you to our first speaker, Dr. Mazin Elmubarak. Dr. Mazin Elmubarak is a medical practitioner and public health specialist from Sudan. He currently serves as the manager of the Sudan National HIV/AIDS and STI program at the Federal Ministry of Health. Previously, he worked as a technical officer at the WHO country office in Port Sudan, where he supported WHO's emergency response with a focus on communicable disease, including HIV and AIDS. So I would like to give the floor to our first speaker, Dr. Mazin Elmubarak. Thank you.
Hello, everyone. Hello, Charlie. Thank you for the introduction. In the beginning, it's actually a pleasure to join you, and I hope this is a fruitful opportunity for everyone to shed the lights on the emergent needs in these regions, and these very fragile regions. Okay, should I now start?
Yes, please. Thank you.
Thank you.
And you can, yes, the slides are also being displayed.
Thank you.
Yeah.
Thank you. So our title is A Wounded Nation is Health in the Shadows of Sudan Wars. This presentation is aiming to shed the light on the emergency of Sudan and how the emergency impacted the health system and how was the response after the emergency. Next slide, please. So our main outlines are the landscape of Sudan's war's toll on health, navigating our challenges and obstacles, and then we will be navigating the health maze and learning more about how to overcome this crisis obstacles. Sudan had been troubled with conflicts and instability for a long time, with many turning points in its history, not to forget the separation of South Sudan and the economic turbulence that followed after. As demographically drivers, we have recurrent multiple ecological shocks, but most often is one of the strongest determinants of the current war. In the middle of all of that, the COVID-19 strike shocked the whole globe, with more damage observed in the fragile context of Sudan. We are not yet to recover from the COVID-19. A catastrophic turning point in our nation history has appeared abruptly with a war among the two armed forces that flared up in Khartoum. Within this chaos, the health system had its ups and downs, with steady general decline over time. The health system is truly burdened with a double burden of diseases and outbreaks, and is now troubled with the energies from the conflict events. However, there is some success that will be also reflected when we are showcasing the response of the health system towards this emergency. Next slide, please. Okay. So in April 15, the war flared up in Khartoum, and then it spread to other states. Khartoum is the capital of Sudan, and the country's system has actually collapsed and paralyzed at the beginning of the war or the conflict. Command of the health system at FMOH, many services are also centralized in Khartoum. Most of the tertiary care actually were also centralized in Khartoum. The war later on extended to reach 13 out of the 18 states, leaving the interventions in the affected states very difficult. Next slide, please. So the total population of Sudan is around 51 millions, from which 24.8 million are actually in need. 48.6%, constituting 48.6%. For the IDPs, we have 13 million IDPs, which also constitutes the largest internally displaced population in the world. And the displacement currently is actually affecting all states of Sudan. Khartoum is the top origin for the IDPs, constituting 30%, 36% of the displacement. The majority of IDPs are now spread across Darfur, Kordofan, and various other regions. 2.1 million people have fled Sudan across border into neighboring countries like Chad, Egypt, and South Sudan. And currently, the country have been witnessing massive floods and heavy rain that have caused additional destruction and displacement. Next, please. Of the population in need, we come to the most vulnerable groups. Here we have 13.6 million children in need currently in the country, of which are 4 million displaced internally and across the borders. 2.56 million were also internally displaced women and girls of reproductive age, and pregnant women constituting 2.25 million. And 6.9 million people at risk of sexual and gender-based violence. Next, please. In terms of casualties, we have 32,576 injuries, reported deaths of around 300, actually from other reported fatalities and other sources. We found 19,000 deaths so far. At least 45 humanitarian workers killed in these events. The attack on health, not only on the facilities, but also the HR, transportation, patients, and so, showed 95 verified attacks, resulted in 153 deaths and 118 injuries. Food insecurity. We have around 25 million people are in high levels of acute hunger, an IPC phase of 3+, and we have 8.5 million people in the emergency levels of hunger, IPC phase 4, and around 800,000 people in catastrophic conditions. The required fund is 2.7 billion. However, the received is 9.6 million by January 24. The land and reduce decentralized capacity, making operation under these circumstances very challenging. And with the massive river floods and flash floods and heavy rains that are ongoing in the moment, also complicating the situation, and also burdens the health system even more. Thank you so much.
Thank you very much, Dr. Mazin. Thank you. So then I want to remind everyone that you can already start sending your questions in the Q&A section, and our team will be monitoring the questions. And after the first round of speeches by our speakers from Sudan, we will address the Q&A. So then I would like to invite our next speaker, Dr. Faihaa. Dr. Faihaa Dafalla is the former Director of Health Planning at Sudan's Federal Ministry of Health. She led the development of Sudan's national health sector recovery and reform plan. With extensive experience in international health and health systems strengthening, her specialities include health reform, decentralization, policy analysis, and sexual and reproductive health. Dr. Dafalla has also worked with WHO on primary health care orientation and universal health coverage in Sudan. So the floor is yours, Dr. Faihaa. Are you able to share your screen?
Thank you very much. Do you see my screen? I think it is already shared. All right, thank you, Dr. Mazin, for giving us how the landscape of the situation in Sudan looks like. Now, I will take you through the world role on health and its challenges and obstacles through looking into the essential services and health emergencies and alerts. At the starting point, the health services accessibility and availability at the first to be affected, mostly due to unavailability of health providers or insecurity, while the active fire shooting and direct attack on the health providers. Also, destruction of the buildings and other commodities and supplies such as water and electricity found to be one of the reasons why there is no accessibility and availability of the health services. Based on the HARS survey that's conducted in 2024 on 5 states, which is 4 of them considered as the safer states, although the war addressing reaching all the states. So the safer states here, with the result of the survey, show that 45% of the health facilities in Red Sea, Hala, the Gadarif, and White Nile are non-functioning, and also only 10% of the facilities are partially functioning, resulting in less than 50% of functioning facilities. In Khartoum, only quarter of the hospitals are functioning, and only 6% of the primary health care are functioning. Therefore, this is a very huge number of inaccessible and unavailable health facilities, leaving us with the low percentage of availability. However, the Ministry of Health at national level estimated that 1/3 of the hospitals in the conflict zone remain operational, and also due to the ongoing floods, it is estimated that 80% of the facilities are non-functioning. Due to the war, before the war, the Ministry of Health have adopted a new essential service package that have been adjusted later after the start of the war to provide a minimum humanitarian service package. Yet its implementation is challenging. Example of some of the programs and the packages are the EPI, the immunization program, which is known to be as one of the best programs in the region. Now they are facing several encounters, starting from distribution of the supply chain and loss of the stored vaccines in several states. Thus, there's the problem of insecurity and accessibility, especially in the remote and war zones, lead to reduction of the immunization coverage. Yet, not to mention the system issues such as the availability of human resources and the capacity building. The other example program is the nutritional program, which is also heavily affected, leaving the country at the premises of hunger crisis. While it seems to be happening already, there is some regions of the country, such as the Darfur, at the IPC level 4 or 5. We have the central Darfur, where under 5 children having 15.6% of them have acute malnutrition. And in North Darfur, in the camp that's called Zamzam, 30% of the under 5 are actually having acute malnutrition. This is in additional to the crisis of the food insecurity. The food insecurity now is leveling up in a very unrecorded level before. This could be due to many reasons, but insecurity led to demolishing or looting of the stored grains at the local level and in the farmers, and or the inability of the harvest of the already planted ones. And also in the current and the previous season, there is inability for crop cultivation. Therefore, the malnutrition is affecting most of the under 5 and pregnant women living in the Sudan in a very devastating situation. For the malnutrition, for the malaria as an example, for the programs that is tackling the vector control, there is an inadequate general vector control, and there's a reduction in the preventive measures due to systems issue, such as the supply disruption, service unavailability, or inaccessibility due to insecurity, also weak capacity for case management, and most importantly, the current ecological condition that has escalated the situation of the outbreak, affecting putting the malaria at the top of the outbreaks. It is affecting now more than 1.5 million people in Sudan. The reproductive health also is one of the most important, and it's one of the priorities for the Ministry of Health. So perinatal care, service delivery, emergency obstetric services, and other services have hugely affected and have huge drawbacks, leading to increased maternal and infant mortality, although there is no actual statistics, definite statistics, but it is obviously observed. Also, we can say that 1.2 million pregnant and breastfeeding women are facing acute malnutrition. And also not to forget the different forms of gender-based violence that is also escalating in the country. Another aspect of the essential services provision are the human resources, who are the backbone actually of the system. And they are also always working at the front line of the system. And there's so much casualties, and there's so much attacks that happen to the health workers, leaving more than 50 health workers being killed while serving serving others. The human resources in Sudan have challenges that is extended before the war have been started, such as the migration, the working condition, and the retention. But after the war, this has been escalating to an alarming level. There is massive displacement internally and outside the country. There's loss of production of the human resources through universities or other institutions, although they are starting to coming back and online, but the number of the production is very low. There's also hurdles in the certification of the health providers, either through the Medical Council or the Sudan Medical Specialization Board, facing serious delays. Also, the issue of the retention of the health workers, especially now after the insecurity, the poor working condition, and the remuneration, because most of the health workers are working without their salaries or partially paid, or some of them are most of them are not actually paid. Therefore, the human resource is one of the system issues that affecting all the part of the system. The supply chain and medicine availability is also been affected heavily. The National Medical Supply Fund is one of the strategies for Sudan, which is the centralization of the warehouse, have been occupied and looted at the very beginning in the first week of the war. Estimated loss at that time was exceeded $500 million. That is most of the stored medicines and supply, emergency medicine, the humanitarian, the reproductive health case and other cases are all lost. This has led to a reduction of the availability of the medicine and supplies and technologies. And also another issue was the loss of the local manufacturer. There were 26 locally manufactured factories that manufacture essential medicine for Sudan, and they are all looted and they are no longer available because most of them, they were in Khartoum. The reduction of the accessibility is one of the main issues that is faced the whole country. It's the issue of transportation, the insecurity that could be happening throughout. Therefore, there's a huge accessibility issue, and this have been negotiated heavily with the armed conflict, with the parties of the armed conflict. This is all led to the dependence of Sudan of importation of those medicine and supplies. However, unfortunately, the regional issues such as the war in Gaza and the conflict in the Red Sea led to complication in the shipping. The air shipping is still not available for Sudan. This is topped with the currency, local currency, and inflation, which has been wide effect on the purchases of the supplies. So taking you quickly through the health emergencies and alert. This map here, you can see most of the states in Sudan, the 18 of them, or let's say all of them, they encounter a concurrent outbreak of, and currently at this moment, as we speak, there's an outbreak of 5 diseases: measles, cholera, dengue fever, malaria, and meningitis. You can imagine how this situation confused the health system, consume its resources, at the same time leading to a frightening among the community and local capacity reduction. Therefore, this is one of the major issues that the Sudan counter at this moment. The surveillance and health information system and the rapid response team are also, because of mainly due to the human resources, are heavily affected. There were at the beginning, especially dysfunction of the health surveillance system, leading to limited detection of the outbreaks and so. And the information system, of course, led to limitation of the data collection, therefore the decision making on resource allocation. And without those reliable data, the health needs, morbidity, mortality, resource mobilization, prioritization are difficult to be tackled. The Public Health Lab, in last April, the National Public Health Lab in Sudan, that is named STAC, has supposed to celebrate its 100th years anniversary. This lab has been looted and has been occupied in the first week of the attack, leaving Sudan exposed to low capacity of, it is the National Reference Lab. It is now low capacity in detection. However, there is a regional labs now are established in different locations in Sudan, but they are actually, like any other institutions, are facing hurdles in sample transportation due to access issues and insecurity, as well as they have a serious limitation in terms of operational capacity, capacity for testing and human resources as well. Those issues have, there is a lot of public health threats that is actually flare the situation in Sudan. The outbreak of communicable diseases, the increased burden of the non-communicable diseases, the situation of IDPs, the sanitation, the safe water availability, all of this in addition in other determinants of health such as the income, employment, the loss of belonging, housing, as well as the education, all of these has actually furthered the situation in Sudan. But another turning point, we never thought it will get worse, but it did actually, unfortunately. The floods that actually hit Sudan are now one of the hardest that in years. And now 16 out of 18 of the Sudan states are affected by floods either from the river or flash floods or heavy rain, leading to affecting about 317,000 people. Leaving 56,450 families, and also affecting or destructing 27,000 households, and also it contributed to additional displacement with about 118,000 people. And this is to say, it's only yesterday that another tragedy that occurred, where one of the small dams have actually broke down in the river Red Sea, where about 70 villages have affected. They are located down the stream, with 20 of them have actually completely wiped out, leaving an additional 50,000 people severely affected, and with loss of more than 10,000 livestock and animals. And the other crisis that accompanying this flood, that this dam is used for storage of the fresh water, because at the Red Sea location, it is way far from the River Nile, so they actually store the water. So the fresh water from the river. So it is actually, it's expecting that this the city of the Port Sudan and the surrounding city will face a severe shortage of fresh of safe water, and then after will come the hygiene and sanitation issues. So this crisis is really overwhelming the system. And as I mentioned before, the displacement and the IDPs is and have been mentioned by Mazin. It is the biggest in the world for now, and it is come with a lot of complexity, with the special need for the people who've been displaced, including they are in need for trauma care, maternal and child services, and emergency ones, managed or their chronic condition. There is a lack of stable housing and sanitation, and there's a huge issue of mental health and psychological issues that need to be immediate attention and support. And there's widespread of violence in this displaced population. Therefore, this is a huge crisis. They are also, with their displacement, adding additional burden on the local resources on the states that are considered as the safer states where these people have been unfortunately being displaced to. So at the system, when we talk about the system in general, we will never forget the financial resources as one of the determinants of this response and resilience of Sudan. There is an obvious lack of financial resources have been reflected by our colleague Mazin, with the $2.6 billion that is in need, and now only less than $1 billion have been mobilized. So there is a huge financial gap and constraints that hinder the ability of the system and humanitarian resources, and this have many reasons, considering the instability, and also the system is now fragile more than ever, with an pre-existing fragility that is topped by many years of underfunding, poor governance, lack of infrastructure, and all of these, most of them are actually wiped out by the war. Despite of these overwhelming challenges, the Ministry of Health and its partner at the national and subnational level has demonstrated remarkable resilience, navigating their way through this complex landscape that have been presented by my colleague, Dr. Mazin, and myself. And now I will leave you with my colleague, Dr. Mohammed, to take you through this health maze of the war. Thank you.
Thank you very much, Dr. Faihaa. Thank you. So I would like to introduce our next speaker, Dr. Mohammed Yusuf Musa. Dr. Mohammed Yusuf Musa is a health economist and senior health financing specialist at the WHO country office in Sudan. He has dedicated his career to strengthening healthcare delivery and improving emergency response in conflict-affected regions. He is recognized for his leadership in advancing health financing initiatives that enhance emergency preparedness and resilience in Sudan's health system. So I would like to invite Dr. Mohammed Yusuf Musa. Thank you.
Okay, thank you very much, colleagues. Hi, everyone. Thank you, my colleagues of Faihaa and Mazin. Just to begin with, Sudan is a country with a complex health landscape exacerbated by conflict. Frontline workers and humanitarian organizations have had to navigate several critical obstacles, including disrupted services, lack of supplies, and escalating health crisis. Despite these challenges, as mentioned by my colleague Faihaa, the health response continues to evolve with innovative solutions to enhance health delivery and emergency response. So, can you move to the next slide? So, the overall response that I'm going to mention is focused around two essential components: essential services, provision, and emergency response. So all in all, I think one of the innovative interventions that led by Minister of Health and local authorities that to engage the IDPs health staff as a state level according to their specialties to work in their displaced areas and being supporting the service delivery in the place where they need to. And also one of the good innovative interventions that led by Federal Minister of Health to have alternative decentralized warehouse, and besides that also establishing new hubs, both government and even UN agencies and some of the NGOs, they have these hubs in different regions of the country so that to ease the response. And also with the support from WHO and other UN agencies, the second public health laboratory in Red Sea has been capacitated and upgraded to be able to test and diagnose most of the epidemics in the country. And as the country facing acute shortages of human resources, right now, Minister of Health managed to improve the capacity of the academic health science. And right now in 2024, around 7,500 students were registered. I think this is one of the good ideas how to tackle shortages of human resources. Basically, those who are directly will be assigned to deliver essential health services. Besides that, also support of partners to the basic essential primary healthcare services, including mobile clinics, became one of the innovative interventions, given the limited resources and given the limited human resources. So supporting primary healthcare became one of the main interventions beside the mobile clinics. And also to maintain provision of essential services like expanded program of immunization campaigns, and also addressing malnutrition beside addressing all issues arising from mental health and reproductive health through mobile clinics. Next. Next, please. So for the other part, the emergency response, despite all challenges and hurdles that I've mentioned by our colleagues, in the previous outbreak, the government and local authorities and with the partners' support had succeeded to bring the epidemic curve of 3 outbreaks like cholera and dengue fever and measles down, and the epidemiologically accepted morbidity and mortality level. And I think that's one of the good outcome given the integrated interventions and support provided by both government and humanitarian partners. Besides that, also implementing national WASH and vector control campaigns, besides promoting child vaccination coverage and introduction of cholera vaccines, and they had contributed a lot to controlling a lot of epidemics in the country. Besides that, also provision of pre-positioned supplies for emergency response, like cholera kits, dengue fever, rapid diagnostic test, public health laboratory consumables, and reproductive health kits. This all contributed to mitigate the impact of the war and the conflict at the community level in general. It's worth to mention that coordination was led by Minister of Health, and there were a different health cluster that I will mention later. Next, please. So we have to admit that humanitarian partners had a great role, pivotal role in the current emergency response in the country. For instance, in health services and emergency medical care, they contributed to distribution of health kits, trauma supplies, surgical equipment, and medicines, and also support improvement of and enhancement of the functionality of hospitals and providing medical care and maternal child health services. In addition to that, providing essential medicine kit and surgical kit to enable hospitals to provide basic emergency medical services. In addition to that, humanitarian partners contributed to improve the disease surveillance and outbreak response in the country by enhancing the work of disease detection and vaccination campaign as well, besides contributing to the overall emergency response. As mentioned by my colleague regarding protection and mental health support, okay. It's worth to mention also there is a good contribution from all humanitarian partners in addressing malnutrition and hunger, food insecurity in the country, and distribution of stable food like rice, flour, and oil to displaced people and even to some host communities, and also addressing provision of nutrition services beside therapeutic feeding programs for malnourished children, pregnant women, and breastfeeding mothers. Next. For sure, protection and mental health support, one of the key critical areas that need to be supported, and a lot of support have been provided by humanitarian partners in protection of vulnerable groups, and also GBV prevention, protection, and monitoring, and legal aid for women, those who are affected by violence during the war, and children as well have been provided. Beside psychological support and psychological services at the community level and outreach through mobile clinics, also one of the basic interventions that are being provided by humanitarian partners. Next. So therefore, I think as for the limited resources that we have, coordination became one of the key interventions. And therefore, the whole response depends heavily on the coordination mechanisms. And a good that we have a good legacy of coordination mechanisms in the country that we built on, like the health cluster. And also we have the WASH cluster, food and nutrition cluster, beside protection cluster and logistic cluster. All this cluster contributed on a way or another to improve access and to enhance emergency response in the country. We have like the active health cluster and the WASH cluster and nutrition cluster. And also we have the One Health forum that focus on the zoonotic disease that might come now and then in the country. So these are the basic clusters that right now contributing a lot to this emergency. Besides that, also we have the advocacy for access. So we have active access group from humanitarian partners that negotiating for safe access for conflict areas for aid deliveries, and they contributed to send a lot of supplies in even close areas like Kordofan and Darfur during this conflict. Next, please. So finally, the top priorities and the needed fund for this devastating conflict in Sudan, just to respond the basic need for health. We believe that our health system have been destroyed, and we need agencies to retain it back. And for instance, just to ensuring the supply of essential life-saving medicine and medical consumables, we need like $600 million US. And to ensure continuity of emergency basic and service to the hospital and health institution, primary healthcare facilities, we need more than 600 millions. And to enable the health system control epidemics and reduce mortalities and morbidities, we need more than 150 millions. And again, to ensure the continuity of mental, maternal and child health programs, we need almost $500 million US. And again, commanding coordination response with all UN agencies and NGOs, we need about 100 million. So the overall needs stand around 2 billion, which is huge. This also will not cover the overall need of the country, health need in the country. So just in conclusion, I said to conclude, addressing health crisis in conflict zone like Sudan requires multi-phased response, encompassing emergency medical care, protection for vulnerable groups, food and nutrition assistance, and disease surveillance. The continued collaboration between government bodies, local authorities, UN agencies, and humanitarian actors. Partners is crucial for sustaining the provision of essential health services and improving health outcome for population affected by conflict in Sudan. Thank you very much, and over to you, analyst. Thank you.
Thank you very much, Dr. Musa, and thank you, Dr. Faihaa and Dr. Mazin, for sharing your insights. It's been very educational and informative. Thank you. So we are having our Q&A session right now, and I would like to encourage everyone to send us your questions. We already received a few. And I will be reading all of them out loud, and our speakers can choose which ones you would like to address and who of you would like to address them. So I'll start with reading. Mawiya Bashir asked, given the ongoing conflict in Sudan and its severe impact on healthcare access, how does the IVPN CGHI joint initiative plan to prioritize and address the immediate and long-term health needs of displaced populations in Sudan, particularly in providing access to essential medications and mental health services? I think this we can leave to the end of the discussion. And an anonymous attendee asked, how are the displaced populations coping with the lack of access to essential resources? Samira Abdelrahman asked, my question is, to what extent are national NGOs, for example, Society Caring for PLHIV, engaged in helping improve access to care and treatment? How is their capacity developed to enable them undertake this role? Mutile asked, have there been any effects of people's movement on the health and social system? For example, people moving from their original homes to a different region in the country. Cynthia Yusuf Masi asked how pharmacists can contribute to global health. Tariq Idris asked, today early morning, the northern state in Sudan was struck by rainstorm, which result in torrents and catastrophic crisis, especially in Marawi locality. Many villages was destroyed. So my question is, what are the Federal Ministry of Health's plan and how they plan to implement? Sama Al-Bakri asked, my question is, you never talk about preparedness nor risk management. What is your plan and how you will make a use of the available opportunities to mitigate further outbreak waves? And there are many questions, but maybe I would just, because our speakers are able to see the questions, so maybe I would ask our speakers to look at the questions to choose which ones you would like to address, and so feel free to unmute yourself and start addressing the questions. Thank you.
I might start by answering the last question, which is about the available opportunities and mitigation measures for the outbreaks. The Minister of Health actually have identified several risk called for action and opportunities to be addressed. For example, I'll just take you through examples. For example, for the security issues or the risks, they have advocated, they call for action to advocate for the peace and humanitarian aid access. But not only from the traditional, but also from non-traditional actors. And this is one of the main actions that is need to be taken, because the peace has to start, the peace has to come first for the country to be able to recover. And there's opportunity have been noted here. For example, there's an effort that's going on for negotiation and a humanitarian corridor are actually opening for more negotiation across the region and globally. One of the limitations is accessibility, also the risk of accessibility due to insecurity. So the action can be or have been identified as advocating for access to life-saving services through proper coordination among the partners, especially the humanitarian partners and the community who have access. And there's actually many efforts have been taken by the committee themselves, who were able to take the flag from the Ministry of Health to reach the communities and provide the services and address the accessibility issue. So there's an opportunity here. For example, there's an open of the border of Adri border and Dabba border also. I think, or a Dabba road for the Port Sudan, enable the humanitarian and essential services and supplies to reach those places. In regard the risk of our limitation regarding the preparedness and response of the outbreaks, there is an action call for collaborative work together, especially now in the rainy season, that is actually topped the ongoing measures and have consequences on the mitigation measures that have been taken for the response for the health. And this is require more attention and focus and also financial support. And there's opportunity here that is there is already plan in place, and there is surveillance system that's out actually now is better functional than before. The risk of the financial risk is actually one of the big risks, because it is accompanied with the additional insecurity, the trust in the system, also providing I just can't find the word in English, but it means that you have assurance that this finance is actually being able to use as it is planned for. So the action here, we need to call for countries, we need to call for advocacy that the country needs so much financing and resources, and there are costed, and there is actually partners in place, and there's different modalities to channel this funding, and they are actually used by several partners such as the Gavi and the Global Fund. They are channeling their financing. Without these resources, the country can't go anywhere. And this is we need to put. There is always risk, but there is always need to put the health of the population at the priority, and the people, the civilians, are actually just a collateral damage. They are facing collateral damage of the armed conflict. And the opportunities here now, the government is actually contributing with so much financing, and they are committed to continue so despite of the economic difficulties. They are doing their best to mobilize resources internally to pay the health workers, and also to pay for the gap of the medicines and supplies. Also, they are putting a lot of effort in providing facilitation of and flexibility in terms of the different channels of financing. And the leadership, and the leadership is amazing, and there's in this time, and there is a good flexibility by the Ministry of Health, ensuring that there is a smooth financial management and assurance for the provision. The last risk I will take care, I will just mention here just for the sake of the time, is the governance and leadership. And the country, it had a national system. They are adopted decentralization that's actually implemented now more than before with the use of the local capacity. And they are ensure the development of strategic sustainable solutions and local solutions, specifically local solutions are the key solutions for all the issues. And there's partner support, and there's rebuild of sustainable system with health, and working through the existing forums such as the clusters and the One Health forums and so on. And there's a lot of opportunities can be tagged here. For example, there's a strategic direction that's clear despite of the ongoing crisis. Of course, there is always uncertainty, but this cannot be the reason. There cannot be the harder that stops the hope for better future. There's also coordination and collaboration with many partners, and they were excellent in coordination their work. The last one, there's efficiency in the response of challenges, and there's a good communication channels going between the partners and the local actors as well, including the community themselves, and also including the diaspora. I'm also going to answer a question about the diaspora. The diaspora or the health professionals who actually migrate from Sudan, and they are no longer here, or the ones who are existing actually outside the Sudan, are the great opportunity that have been mapped before the war, and now more than ever the contribution is massive in terms of financial mobilization and resource availing resources, and also they are calling for actions and also providing virtual technical support for Sudan. And just 2 hours before this webinar, there is a webinar. Maybe Dr. Hala here, I see her in the participants. She is the director of the Global Health Department in Sudan. She's the one of the many speakers who reflected the role of the diaspora. And many of the diaspora that I spotted, they were part and they reflected the roles. One example for those diaspora who led the massive contribution to the Sudan during this war. They are also has accessibility to one of the community, and the local workers are the Sudanese Physician Association, American Association for Sudanese Physicians, and this was massive. And there are many examples how the diaspora is still. Some of them are still travel Sudan sometimes, go to the Port Sudan and providing a lot of support to the Ministry of Health. I will stop now, giving a chance for my other colleagues to answer. Thank you.
Thank you,
Okay.
Dr. Faihaa. Yes, our other speakers, would you like to address one or two more questions? And we will leave the other questions to the end of our webinar. So we have enough time for Gaza as well, but we still can take two more questions. Thank you.
Yeah, just a few comments because more or less Faihaa, she covered all the questions, but it's worth to mention that all the interventions we have mentioned still remain very minimal when we compare to the overall dire need of the health in Sudan. Nothing optimal, whatever have been mentioned. There is no optimal intervention. These are all contributions trying to mitigate this dire need of help right now. So what has been done by Federal Minister of Health, by local authorities, or by other humanitarian partners remain still minimal compared to the overall health need in the country. But we have mentioned some of the preparedness and response because also we cannot, in this limited time, to mention everything, but provision of pre-position supplies. This is one of the good preparedness arrangements that we put in place. There is a question also for referral during this conflict. I believe this is one of the difficult issues because right now access became also one of the big issues right now beside the high cost of transportation. So referral still remain one of the challenges that need to be addressed, and is still one of the unmet needs of the population is the referral system in the country. We have to say that. Again, engagement of the local community, I can say that still this is minimal, not to the optimal level. Community resilience. One asked about the how can communities cope with the current situation, but given the inflation and given of the high cost of living as well, right now even the coping mechanisms are not so far resilient with the huge conflict that people are facing, and therefore I think still people will suffer. Unfortunately, I have to say that this situation will not be ended soon. We hope so in soon everything to come to the end, but this will continue for longer time. And as far as we are moving forward, this will affecting a lot of people. So we need everyone to contribute. Still our contribution is very low. Again, it's the need, and that is why we need to advocate for more resources, for more contribution from humanitarian partners and from other UN agencies as well. They are doing great, but still we need more to tackle these issues. Thank you.
Thank you, Dr. Musa. Dr. Mazin, would you like to say some closing comments before we move to Gaza?
Yes, thank you. Thank you so much, Charlie. Well, I think everything was almost covered by my colleagues. Thank you for that. I would just like to point out that the situation is pretty much complex, and the effort that has been done so far might not be sufficient, but it had some impact on ground, and it has actually covered some of the needs that are dying. I looked at some questions, and one of the questions were asking about the point of decentralization during the war conflict time. I think this is a very good question. It's recently one of at least in our program, one of our strategies now. And decentralization enables the states to take to be empowered to take over the implementation of activities, and pretty much makes it more resilient to respond to in emergencies and not only wait for the central units to take the lead in such stuff. So I think it's very important in such a large country like Sudan with many states and different challenges between states. It's very important to build some sort of a state capacity that can be resilient and has more timely response to an opinion. The question was about people who are displaced that are facing this issue with lacking of health services. Honestly, I think it might be different from someone to another, but generally, people now not only depend on the governmental services, but also they receive services from other NGOs and partners on ground, as we have different partners working to at least meet the needs of the primary healthcare and then meet other public health needs. I think that was all for me. Thank you very much for this opportunity, and over to you, Charlie.
Thank you, Dr. Mazin. Thank you, Dr. Faihaa and Dr. Musa. Thank you very much. So we are still taking in questions for Gaza as well, and our speakers are also able to address your questions in the end of our webinar. Also, they can text their answers to your questions. So everyone is also still welcome to ask your questions. So now we're moving. Yes, go ahead.
Charlie, before you move on, after thanking all the speakers, I think it was very informative. There is a question was like provided to us, and we can, as you mentioned, we will address it after the webinar. Maybe it will be already addressed during the webinar, but we will be giving it a light at the end. Thank you.
Yes, great. Thank you, Rafa. So we would like to, be mindful of our time, and we would like to move on to our section, focusing on the health crisis in Gaza. And I would like to introduce our next speaker, Ms. Hala Redwan. Ms. Hala Redwan is the president of the Palestinian Pharmaceutical Students Federation. She holds a bachelor's of pharmacy from Al-Azhar University in Gaza and has a solid background in the nonprofit sector. She has worked for the Palestinian Medical Relief Society and for Safe Youth Future Society, where she led initiatives to support marginalized communities in Gaza. So I would like to invite our next speaker from Gaza, Ms. Hala Redwan. Ms. Hala, are you with us? Ms. Hala is joining us from Gaza, so her connection might not be stable. I think I heard you, Ms. Hala. I think it's just a little bit low, the volume.
Yes. You can hear me right now?
Yes, yes. Do you perhaps have a mic and can speak to the mic?
Charlie?
I think yes.
Rafa, can you hear me?
Yes, we can. Yes, go ahead. Thank you.
Yes, and I have shared the screen. You can go ahead, Ms. Hala.
Yeah. Could you please just share the screen so I can start?
Yes, we can see the slides.
Okay, that's perfect. So my name is Hala Redwan. I'm an enthusiastic pharmacist. I'm from Gaza, Palestine, and I'm a survivor of this war. Today's, inshallah, I'm gonna talk a lot about the health crisis in Gaza and an urgent call to action. And we're gonna start with the overview of the impact of war on Gaza health system, started from the numbers in Gaza to talk about injuries, displacement, and deaths numbers. So at least more than 40,000 people have been killed and murdered, and more than 92,000 people wounded during this Israeli war in Gaza. And of course, more than 1.9 million people of Gaza population, 9 out of 10 people closely are internally displaced, and many times, and I'm one of those. I displaced from the north to the south during the first week of the aggression, and I evacuated like 8 times during this war, and this is like a real story of every Gazans, and I'm one of those. An estimated of 43,000 are pregnant women, and they are supposed to give their birth during a very harsh conditions. And my sister was one of those who gave her birth during harsh conditions without like healthcare system. So each evacuation order upends lives, and in no place can survival be guaranteed. Next. moving to the next about the operational challenges, and I'm gonna take a look.
Charlie, can you hear? Because I lost the
No, I also lost the connection. I cannot hear from Miss Hala. Miss Hala, is it possible for you to turn off your video? Maybe that will help. I will also turn off my video.
Many of Gaza's hospitals and clinics, reducing the capacity of the healthcare system to respond to the crisis. And attacks on health facilities have further disrupted the delivery of medical services, leaving the few remaining operational hospitals overwhelmed. Of course, the water and sanitation crisis are one of the most operational challenges in Gaza, because Gaza's water infrastructure has been devastated, leading to a lack of access to clean treated water, and the ongoing damage to water system and the inability to repair or to rebuild them due to restricted access to necessary materials have resulted in a public health crisis, with diseases like polio and cholera posing significant risk. And this is what I will address furthermore. So fourth, the logistical and safety issues. The ongoing war in Gaza has made it extremely difficult to safely transport humanitarian aid, including vaccines and medical supplies, into Gaza. And the need for a ceasefire is critical to ensure the safe and unobstructed delivery of aid and to protect civilians and health workers. And the overcrowding and poor living conditions that we live in Gaza, the destruction of homes and displacement of thousands of people have led to overcrowded shelters, especially in the southern area of the Gaza. Like, people are displaced many times from the north to the south, with the overcrowded shelters, in tents, with poor living conditions, without access to clean water or electricity or any life essential resources. So these environments are breeding grounds for infectious diseases, further straining the already fragile healthcare system. And these challenges require an urgent response, including the need for a ceasefire, scaled up humanitarian aid, and unrestricted access to essential resources to prevent a further health catastrophe in Gaza Strip. So moving to the next slide, next please, the impact of war on health system in Gaza. So I'm gonna talk a lot about the destruction of health infrastructure, the attacks on hospitals and health workers, and of course the restrictions on medical supplies. The war in Gaza has caused severe damage in its healthcare system, which is now struggling to meet the basic medical needs of its population. And several factors contribute to this crisis. Firstly, started with the destruction of health infrastructure, such as hospitals, clinics, and medical facilities in Gaza have been bombed or severely damaged. And of course, you heard about the massacre that happened in Al-Ma'madini Hospital, and of course, and Shifa Hospital, and the other hospital that's located in the north and even in the south area of the Gaza. And this destruction has dramatically reduced the number of places where people can receive medical care. For example, if a hospital is destroyed, it not only loses its ability to treat patients, but it also impacts the surrounding community that relied on it. And for that, they started like an urgent clinic, during this emergency campaigns. It's located in tents, like it's a small clinic operated its function in a tent. And can you imagine how the situation is catastrophic there? So seconded by the attacks on health workers, like health workers in Gaza are operating under extremely dangerous conditions, under attacks and under a bombardment every now and every from time to time, and in daily basis, attacks on these workers make it difficult for them to safely provide care. This also discourages others from working in health sectors, leading to a shortage of medical personnel. And of course, the shortage of medical supplies. Due to this war, there are severe restrictions on the importation of essential medical supplies into Gaza. This include not just medicine, but also vaccines, surgical equipment, and even basic items and medications. Without these supplies, hospitals cannot function properly, and doctors cannot treat their patients effectively. And the impact on disease management, the damage to Gaza water and sanitation system has led to the spread of infectious diseases like polio, which had been eradicated in area for approximately 25 years without clean water. The risk of other diseases such as cholera increases significantly, and the healthcare system, already weakened by the conflict, is now struggling to contain these outbreaks. So the few remaining operational hospitals are overwhelmed with the number of patients, and these facilities aren't only dealing with war injuries, but also with regular medical cases that have nowhere else to go. The lack of resources and the high demand for care means that many people aren't getting the treatment they need, leading to preventable death. So the war has pushed Gaza health war system to brink of collapse with damaged infrastructure and severe lack of medical supplies. The system is unable to cope with the current health crisis, let alone any future outbreak of diseases. And this situation underlines the urgent need for a ceasefire, as I mentioned, increase humanitarian aid and effort to rebuild Gaza health and water infrastructure. Moving to talk about the communicable diseases and non-communicable diseases, we all know that communicable diseases are those that can spread from person to another, often exaggerated by the condition created by the war. And the first one is the polio outbreak. Polio is a highly contagious viral disease, has re-emerged in Gaza after, I told you, 25 years of being eradicated. This virus has detected in wastewater, especially in the Dafalla and Khan Younis city, indicating that it's circulating again due to poor sanitation and overcrowding living conditions. The first confirmed case was in an 10-month infant, unvaccinated infant, and the situation is expected to worsen as the war continues to disrupt vaccination campaigns and access to clean water. And the second is the potential for a cholera outbreak. Cholera, a bacterial infection often transmitted through contaminated water. Without clean water, people are forced to use unsafe sources, which increases the risk of cholera outbreaks. And if it spreads, it could lead to a large number of preventable deaths, particularly among vulnerable population like children. And the third one is the respiratory infections and waterborne diseases. As a result of overcrowded shelters and poor sanitary conditions, the spread of respiratory infection and other waterborne diseases is existing in Gaza, with a healthcare system overwhelmed. Treating these illness become increasingly difficult, leading to a higher morbidity and mortality rate. And moving to the non-communicable diseases, as we all know that it's like long-term chronic conditions that aren't spread by infection, but are affected by the impact of the war. And one of the main reasons for that is the interrupted treatment for chronic diseases and the chronic conditions. Like many people in Gaza suffer from chronic conditions like diabetes, hypertension, and heart diseases, and the war has disrupted their access to necessary medication and regular medical care, which can lead to serious complications or even death. For example, diabetic patients unable to access insulin due to supply restrictions might experience life-threatening complications. And of course, the mental health issues, the trauma of living in a war zone, witnessing violence and loss of loved ones have led to a significant rise in mental health issues like depression, anxiety, and PTSD. The ongoing war exaggerate these conditions, and the limited mental health services in Gaza are insufficient to address the growing needs. And talking about cancer treatment disruption, like cancer patients in Gaza face critical challenges due to the lack of chemotherapy, radiation therapy, and other essential treatment. The destruction of health infrastructure and restricted access to medical supplies mean that many cancer patients cannot receive the life-saving treatments they need, and the increased risk of cardiovascular diseases, the stress and strain of living in a war zone coupled with limited access to healthcare and medications can increase the risk of heart attacks and strokes. Additionally, the lack of access to healthy food due to supply chain disruptions can worsen conditions like hypertension and high cholesterol. And moving to talk about water and sanitation crisis that are the main reasons for the mentioned diseases. The causes of this is the destruction of infrastructure. The war has destroyed or severely damaged much of Gaza water and sanitation infrastructure. This includes water treatment plants, pipelines, sewage system, and desalination facilities. Without functional infrastructure and the ability to provide clean water and manage waste effectively is greatly diminished. And of course, the restricted access to supply. The ongoing war has resulted in severe restriction on the import of essential material needed to repair and maintain water sanitation system. Items such as the water chlorination supplies, fuel for water pumps, and spray
I think Miss Hala's connection froze.
shortage of the fuel needed to operate generators that power water pumps and treatment plants. And as a result of that, many water facilities are either operating at reduced capacity or have ceased function altogether, further reducing the access clean water. And next, to talk about the polio, as I mentioned it, and the recent developments by the WHO and the risk and the prediction. So as I told you, the polio cases in Gaza detection and spread in July 2024. The polio virus was detected in wastewater sample in Deir al-Balah and Khan Yunis, two areas within Gaza. The presence of the virus in wastewater is an indicator that virus is circulating within the population, likely due to the contamination of water sources and poor sanitation condition. The first confirmed case of polio in Gaza was reported in August 2024, in this month, involving an unvaccinated 10-month-old baby, as I mentioned. This case signals that the virus is actively spreading in the community, particularly among children who haven't been vaccinated. And the contributing factors for that is the destruction of water and sanitation. And vulnerable to the virus. The ongoing hostilities have made it difficult to conduct a large-scale vaccination campaigns, furthermore exaggerated the risk of widespread outbreak. And we all know that the given treatment a response to this virus is vaccination, that it should be conducted by the WHO, and there are many challenges in order to give these vaccination, especially to the children. But the recent development regarding that, like WHO's planned vaccination campaign faces delay due to the hostilities and the risk of, and the predictions is about overcrowded, unsanitary conditions may lead to rapid disease spread. And
Hello, Miss Hala.
improvements in
Yes,
water
go
and
ahead.
sanitation are essential to, yeah. Can you hear me?
Yes, your connection is back. We have maybe you can wrap it up in 2 minutes, and we will have our Q&A session, and we will invite you back if that's okay, because your connection is unfortunately not very well right now. Okay, thank you, Miss Hala. I think her connection is not very good right now, and we are deeply grateful that she's, using all her efforts to join us from Gaza. Next, I would like to invite Miss Saja to give us a quick overview from the global health perspective from Gaza. I don't know if Miss Saja is ready.
Yes, I am. Thank you.
Great. Yelena, would you like to share the slides?
Yes, just a moment, please.
Thank you.
Can you see the slides?
Yes, thank you.
Okay, I will be muting.
I will give a quick introduction of Miss Saja. So, Ms. Saja Abusulttan is a global health researcher and a Palestinian refugee who lived most of her life in Gaza and worked in both public and private healthcare sectors. Saja holds 2 master's degrees in global health and public health from the Netherlands and UK. She currently works at Erasmus MC in Rotterdam, focusing on health and migration, drawing from her personal experience as a refugee. Saja offers a unique and deeply informed perspective on the health crisis in Gaza. So over to you, Ms. Saja.
Thank you so much, Charlie, for inviting me and for this webinar. I would like to thank everyone from the panel as well, and my colleague, and Hala, as well for her presentation during this ongoing hard times. And thanks a lot for joining us as well. And yeah, thank you so much. So the ongoing events in Gaza has led to devastating consequences, severely straining the already fragile healthcare systems. They have caused unprecedented levels of death and destruction, severely impacting the 2.2 million people. This violence against civilians and infrastructures, combined with critical shortages of essential medications and healthcare personnel, has drastically hindered the delivery and accessibility of medical services. And this situation actually sparked urgent concern about the looming health crisis affecting the entire population. Reports from various independent organizations highlight alarming increase in mortality and morbidity rates, particularly among women, mothers, and children, as the war persists. Additionally, inadequate sanitation and limited access to clean water, which led to a rise of infectious disease. The psychological and mental health impacts of the conflict are likely underestimated and will continue to be significant even after this ends. Next, please. So talking about the health problems as a result of the ongoing war. Health delivery and accessibility. The events in Gaza has severely disrupted access to healthcare, leaving 350,000 people with chronic conditions. 50,000 pregnant women without essential care. Approximately 1,000 patients need kidney dialysis, but 80% of the machines are in hospitals that have evacuation orders and are no longer functioning. Even before the conflicts, Gaza faced a critical shortage of medication, leading to the suspension of elective surgeries to conserve supplies of emergency. This shortage now endangers the lives of many patients, including those with cancer and kidney disease. Next, please. The World Health Organization actually has raised alarms about the high risk of infectious disease among the internally displaced individuals and persons in Gaza, because of the severe crowding and combined with collapse of health and sanitation systems, has already led to outbreaks of infectious respiratory infections, skin infections, and hepatitis, beside all the infections Hala has mentioned earlier. Healthcare workers report unsanitary conditions and a rise of diseases like polio and other conditions. Talking about reproductive health, which is also under, which is a very marginalized topic within our context, especially in the global north. The crisis has had a devastating impact on women's health, and thousands losing their lives, and many more facing challenges like hunger, displacement, and lack of access to basic hygiene resources. Pregnant women are especially vulnerable. Over 50,000 pregnancies are at risk to lack of adequate medical facilities. Among those, 15% are likely require additional medical care due to complications. However, access to life-saving obstetric care is severely limited. The severe shortages of drugs, blood products, and medical supplies and fuel further restrict the ability of these hospitals to provide adequate care. Health providers in Gaza have reported that some surgical procedures, including cesarean section, have been performed without anesthesia. The stress, insecurity, and starvation caused by the conflict are expected to have severe, lasting impact on future generations. Pregnant women exposed to such conditions have higher rates of miscarriage, stillbirth, prematurity, and congenital abnormalities. Reports already indicates increase in miscarriages, actually, additional to the long-term development and functioning of the children who are born to women who experience such extreme violence and stress and starvation. Next, please. Mental health. The events since October last year has severely affected mental health, with nearly half of the population experiencing cognitive and behavioral issues. Children are particularly vulnerable, with high rates of post-traumatic stress disorders. The destruction of healthcare infrastructure, including the only psychiatric hospital, has set back mental health care by years, worsening an already dire situation. Next, please. Water and sanitation. Gaza is facing a severe water and sanitation crisis, with less than 4% of the fresh water is safe for drinking, and this is before the war, actually. So the ongoing conflict has exacerbated this crisis, leading to critical shortages of clean water and inadequate wastewater sanitation, which pose significant public health risk. The blockade has further hindered the development of essential water and sanitation infrastructures, forcing residents to rely on unsafe water sources with particularly dire effects on health. Next, please. The ongoing conflict in Gaza has caused immense suffering, particularly in healthcare, disease control, reproductive health, mental well-being, and water sanitation. And there's an urgent need to a ceasefire to address this humanitarian crisis. The shortage of fuel, lack of shelters, and damaged medical transport have made it nearly impossible for those with a chronic condition to access necessary care, and the conflicts actually has triggered a humanitarian crisis that demand immediate action to protect civilians and prevent health catastrophe. Thank you.
Thank you, Ms. Saja. Thank you. I would like to invite our next speaker, Mrs. Nour. Mrs. Nour Arnaout is the Associate Director of the Global Health Institute at the American University of Beirut. With a decade of experience in digital health and health systems strengthening, she has led major research projects in underserved communities and published extensively in journals like The Lancet. She also manages the Non-Governmental Organizations Initiative at the AUB, expanding its reach to 7 MENA countries. And at the same time, I would like to encourage everyone to keep asking your questions in the Q&A, and we will address them in the end of Mrs. Nour's presentation. Thank you, Mrs. Nour.
Thank you, Charlie. It's a pleasure to be with you tonight. So I originally had a slide deck, but I'm not sure how much I'm going to stick to it, given that Hala and Saja spoke about these figures. But I just wanted to mention something, that these figures of displacement, death, and morbidity are repetitive figures that we see and we suffer from in the MENA region. For those who are not very familiar with the context of conflict in the MENA region has been suffering for the past decade or two from continuous conflicts, be it civil wars, be it conflicts such as the one we are witnessing now in Gaza, and Palestine and Gaza have been witnessing such conflicts for the past, at least 40 to 50 years now. And this war that we are seeing is not only a war that is affecting civilians, it's also affecting the healthcare system at different levels, be it the healthcare facilities that are being affected, the healthcare workers that are targeted directly, the paramedics, and all efforts related to the healthcare system. And this notion we have previously spoke about in a publication that we have published in The Lancet during the times of the war in Syria. We call that the weaponization of healthcare. This is when healthcare is purposefully targeted during wars, and this is a strategy that is usually adopted in times of wars and crises, because we all know the importance of the healthcare system in times of conflict. And this is because war itself, it leads to major challenges when it comes to increased morbidity, mortality, and all the cases that arise during times of war, and displacement itself, which renders people who are being displaced more susceptible and vulnerable to diseases. And this is actually being further limited by the operational challenges that Hala spoke about briefly before, and I'd like to elaborate on some more of these challenges. And the reason why I'd like to elaborate more on these is that a month ago, we were meeting in Jordan with key non-governmental organizations and healthcare organizations that are working on the ground in Gaza, be it UNRWA, be it other local organizations that are being super active in providing healthcare services to those that are being affected in Gaza. And all of them, they have spoke about these operational challenges that are majorly hindering their operations on the ground. So many of them raised the concern that, if we have a huge donation of medications, but we do not have, the safe roads to deliver these medications to where they should be delivered, then all of that is a relatively nonsense. So some of these operational challenges is the actual, shortage of medical supplies and equipments and medications, the stress that is being, exerted on the healthcare workers that are operating, in war times, witnessing all these crimes, and they are, having this commitment and dedication to still continue providing healthcare services. This by itself is, a significant stress being exerted on these healthcare workers, which actually leads, to disrupted and reduced capacity when they are providing medical services. And we know, all of us know the amount of focus and accuracy and precision that is needed when providing medical services and attending to patients. There's also the poor communication vis-a-vis the real need for coordination and communication among different parties that are operating on the ground in Gaza, limited access to necessities that are needed to operate and for health facilities to function, such as fuel, for example. The lack of access to basic amenities that Hala mentioned and elaborated on, including food, wash, shelter, and others. And we're gonna speak later on the about the availability of safe water And you know, the lack of such safe water, the problems and the diseases that emerge due to that is, you know, beyond what you can imagine. And obviously the high level of insecurity. So these operational challenges were actually coupled with a huge attack on the healthcare system in Gaza. We have lost a lot of healthcare workers due to this war. Many of them also left the country, although they provided a lot to the country, and we totally understand why they left the country. Many of them were injured. There were direct attacks on healthcare facilities, on hospitals, on paramedics, on ambulances. All of that limited the capacity of the health system to respond to the need that is being present in Gaza. These figures on communicable and non-communicable diseases already Hala and Saja elaborated on these, so I'm not going to repeat what my colleagues said, but we have, you know, figures that are in thousands when it comes to diseases and infections in Gaza. Also, Hala spoke about the polio outbreak, which we haven't witnessed like this outbreak recently. And this is, you know, a natural outbreak that we usually see in times of crises and conflicts due to mainly a lack of access to safe water for drinking and bathing. Even during that meeting we had last month in Jordan, you know, organizations were raising the concern about the lack of safe water, even for, you know, basic needs, and, you know, use of toilets and the availability of soap. So things that we usually take for granted and we have at our homes every single day, people in Gaza, they lack access to. So how to respond to these figures from a health systems perspective, and how can we address this need that, you know, is arising in times of conflict, be it in Gaza or in similar situations? Because, you know, this is something repetitive, and this is something that we are not witnessing for the first time. Maybe this is happening for the first time at such a scale in the, you know, recent decade, but similar wars are being witnessed in the region repetitively. So some of the solutions that we at the Global Health Institute at the American University of Beirut have been advocating for and have been actively working towards, you know, designing and implementing such, you know, interventions and solutions is one, the idea of decentralizing the delivery of healthcare in areas of conflict such as Gaza. And this is primarily possible through mobile health units. So if we, you know, go away from the idea of providing health services through hospitals and large facilities to providing health services through mobile health units, which is something that is currently being implemented on the ground in Gaza. For those who are not familiar with the context, many organizations, local organizations particularly, and international organizations who are providing healthcare services on the ground in Gaza are actually operating through mobile health units and mobile health clinics. And these health clinics are either fixed in certain locations, or they are rotating and moving from one location to another, or from one camp to another. This, you know, movement of the health clinic and the idea of decentralization of health service delivery enables an increased accessibility to health services. Because these units can reach remote and underserved areas easily, people do not have to worry about transportation or movement under severe conditions such as the unsafe roads and the security matter, and, you know, wondering whether they will be bombed or not while going to the health facility. Also, the idea of mobile health units is a convenient idea when we speak about conflict, because we can adapt the health units or the mobile health units to deliver any type of care. Care related to maternal health, sexual reproductive health, mental health, pediatrics, even surgical care is now being delivered at mobile health units. So the versatility of the services that can be delivered through mobile health units is another advantage of such solutions. The third point is the resilience of such units in crisis, because these units can function either in relation to existing health facilities or independently as standalone facilities to deliver health services. So this is one of the solutions that we have been focusing on. Another is the electronic health records, and we at the Global Health Institute have created a cloud-based electronic health record that functions totally offline. It's called CGHI. You can Google it and see that we have implemented that previously among 10,000 Syrian refugees that were residing in Lebanon. And we are now in process of partnering with organizations operating in Gaza to provide patients that are affected by the war in Gaza with this electronic health record. So such electronic health records are essential because they enable the continuity of care for patients, especially that patients in Gaza and in conflict settings, they are constantly on the move. So they seek healthcare service today at this specific clinic that is operated by one NGO, and then the other day they seek another type of health service by another health clinic that is operated by a second NGO, and later on they may move to a whole different location or even move and seek care outside of the country, maybe in Egypt, maybe to other countries as well. So providing them with solutions such as an electronic health record that is cloud-based, that they do not have to physically be attached to, or that is not restricted to only one health provider, is essential, because this will enable the patients in Gaza to store their health data in a secure and safe space, and be able to use this health data whenever they hit the healthcare system. And, I'm just giving ideas about what we at the Institute are working on, but this is, also an idea about solutions that all of the global health professionals that can be thinking of and using to develop further interventions or think how to support people that are being affected by conflict. And the third point that I'd like to shed light on is the importance of investing in training of community health workers. And this is because in settings like conflict settings, be it what's happening in Gaza or what usually happens in conflict areas, community health workers, they play a crucial and very important role in their communities, and they actually serve as focal points when it comes to consulting someone about their health. They can play an active role in raising awareness and detection, and even in referral. And we know that the referral mechanism itself, it gets disrupted during times of war. And also the community health workers can play a role of a gateway, because they can be able to detect what are the cases that are need to be referred to, the clinics or the health facilities, and those, that can be solved conservatively within the community. And this would actually reduce unnecessary stress on the healthcare facilities. So it is very important to understand the current situation in Gaza and in conflict areas, and to think about the figures that the wars and the crimes have inflicted, but it is also very important to always think about the future and what will happen when ceasefire will happen, will take place, when the war will end, when it's time to rebuild the healthcare system. So what are the steps that we will need to adopt at that time? And it's also very important to remember that it's always good to have a plan, but what's more important, it's to have an idea of how we want to implement this, and a real understanding of the context and of the players that are being on the ground. And this is why we always believe that if rebuilding is going to take place, it's going to take place through the effort of local actors, of local organizations, of local healthcare professionals like Hala, like others who are on the ground and who are not tired of providing care to the community, and who are dedicated to continue their mission despite of everything that has happens in times of wars and crises. Thank you so much.
Thank you very much, Mrs. Nour. Thank you. And thank you to our previous speakers, Ms. Saja and Ms. Hala. And we have 9 minutes left for our webinar. And I would like to ask Ms. Saja to address a few questions that you've seen from the Q&A box. And also feel free to give some final comments. And then I will ask if Mrs. Nour wants to address any of the questions in the Q&A as well. So Ms. Saja, are you ready?
Yes.
Great.
Thank you, Charlie, and thank you, Nour, for your presentation. And yes, I can address the first question, which is about water sanitization and purification. Is it enough to prevent polio? Well, actually, it's about the ongoing bombardment and the ongoing displacement that led to to unclean water and all of the things that led to those infectious disease. So to address this, we have to do first ceasefire. We have to call for a ceasefire, because then we can do other measures. For example, there is not enough water. First of all, there is no clean water, and this was already before there wasn't clean water. Gaza has exposure only to 4% of water, which was clean, and this is before. So people used to buy their own water. Which was very expensive. That people have to daily look for ways to provide a clean water so they can they can live on. But because of what's happening, Gaza population are being displaced at least 8 or 10 times. So people lost their own infrastructures. And even though when there is a new infrastructures are made to purify the waters, everything, there's always bombardment that those infrastructures are being as well targeted. So the idea is to have first ceasefire. The second thing is that, as Hala mentioned before, polio was eradicated maybe before 2005, and because also of active vaccination programs, which has been for long. So there was no any polio cases since long. But as a result of the infectious disease that are spreading, and because there is no vaccination programs, we have a new generation of children that has no vaccination at all, not only to polio, to other conditions. And the ongoing bombardment reduce any possibilities to provide those vaccination programs. Even with the ongoing talk and negotiation about a ceasefire, there's lots of talk about humanitarian ceasefire, or something that vaccination can enter the border, that those children, that new generation of children can have those vaccination before they are getting the infection. So we have the vaccination problem, we have the already the restoration of water before the October 7th, and we have also the ongoing bombardment and infrastructure, which hinder any sustainable solution. So this is one of the question I could address. The other one, I think, is related more to the context of Sudan, but there is a question about the last one, which is about whether or not Yes. However, I would like to know if there is any implemented solution on land to mitigate the effect of conflict on people mental health, as the most sustainable solution will be peace and will be ceasefire and will be ending any casualties, ending any conflict actually. So if we invest in peace, if we invest in peace and justice, then we wouldn't have that impact of conflicts. And if we invest in less war, if we invest in if we stop actually arming any kind of parties in conflict as well. So this would lead to less conflict. This would lead to better mental health. So because most of our humanitarian work is being done in conflict area, which is very important, but mostly it's emergency related. It doesn't address the long effect and the long impact of this war. So we need to be united and joined against the war. We don't need to have wars. Actually, there is no how to say, there is nothing come with war. War has lots of impact in people's health, not only as a direct impact that causes direct casualties, but we have, as the Lancet published recently, there is estimation of 200,000 Palestinians to be killed in this ongoing crisis. And those are 200 not directly from bombardment, they are from those who lack the medication, those who died from chronic disease that are manageable, those who died from malnutrition, those whose bodies are no longer tolerating what's happening. So the war can cause lots of casualties, lots of mortality than we would ever imagine. I hope I addressed the questions, and I'm open also to any other question. Thank you.
Thank you very much, Ms. Saja. I would like to ask if Mrs. Nour would like to address any of the questions in the Q&A, or if you have any closing comments, and then I will invite Rafa from IVPN to also give her closing, and then we will also give our closing. So, Mrs. Nour, would you like to say something?
Thank you, Charlie. I think Saja addressed most of the comments that were in the Q&A, but I just wanted to reiterate a point that she mentioned. It's about ceasefire. So the starting point for all of the conflict resolution and for us thinking about how to rebuild the health system is ceasefire. And this is something that we should all be advocating for right now. It's always good to speak out loud about the conflict, about what these crimes are causing at the level of the population health and the health systems at large. But we should always also keep in mind that what we need to be advocating for is the ceasefire. So thank you so much.
Thank you very much. I want to ask if our speakers from Sudan would like to give any closing comments, or if you feel like what you gave was very sufficient. We have 2 more minutes left for our webinar.
Yes, if my colleagues allow me, I would like
Yes,
generally to urge all the participants here to join us in focusing the attention on the overlooked enduring war in Sudan. This crisis has far-reaching consequences, not only for the Sudanese people, but across the border for the entire region. And this was obvious and evident. As we anticipate the transition from humanitarian assistance to development program, it is crucial to recognize the urgency of this shift right now. Despite the severity of the crisis, Sudan has a potential for recovery, and it has a capacity for developmental program to make this early transition feasible. So Sudan remains as a fertile land for investment, offering numerous opportunities for growth and progress. And let us work together and advocate to support Sudan peace, recovery, and build a brighter future for all the people. Thank you.
Thank you very much, Dr. Faihaa, and thank you to all our speakers. Rafa, would you like to say any closing comments from IVPN?
Can you hear me well?
There's echo somehow. Let me mute everyone, and then you can unmute yourself. Can you unmute yourself now?
Okay, now?
Now it works. Perfect. Go ahead.
Okay. Always we have the technical issues. Despite that, digital health is now being from Dr. Nour speech. It will be something very promising in such situations and in healthcare strengthening. I'd like to thank you, Charlie, Jelena, Mohammed, and the IVPN working team, everyone, and all the speakers for the great session. And I'd love also just to shed the light on few contributions that as NGO and NPO we can provide IVPN from my side, and maybe when you close you can add some for CGHI. But mainly our role will evolve around like advocacy, increasing the evidence, research papers, policy papers, raising awareness, as you can see, like especially in the case of Sudan now, like it's not very well known around the world. So such events, research papers, policy papers, and so on will help in that. Having focus on the healthcare workers' safety, writing some policy papers on that also would help. And this is part of what we do: capacity building, sharing some scholarships and resources with the displaced populations, and so on. All that is part of our objectives and strategies. Other than this, coming from a pharmacist and public health background, the integrated healthcare system, advocating for that and ensuring that there is coordination between the different multi-sectors. And you can even check our previous webinars and articles which highlight the role of different parties of healthcare system in order to bridge the gaps and ensure that, for example, vaccination, it's given in the right way, it's given with more access. The medicines, essential medicines, they are given in better access. Digital health also, you will find that there are a lot of our activities, they focus on that, and it's the future actually, and you can find a lot of improvement due to digital health. Regarding mental health, because many people have highlighted this, and even if we all want the ceasefire, but currently the mental health, we as healthcare professionals and as global health professionals, we can work on that. We can initiate campaigns and look, be ready for upcoming campaign from the Global Health Listserv that will address this and will have a lot of activities on this. Thank you again, everyone, and thank you, Charlie, for moderating the session and for this collaboration. And I wish you all a very nice night. Thank you.
Thank you, Rafa. So from CGHI, we are a community of young professionals and students from 6 different continents. So we contribute by creating community for people who are starting their career in global health and development. And we gather together, we meet every 2 weeks, we talk about what's happening in our field. We're from a very multicultural and multidisciplinary background. So how we contribute to this discussion is that we have our community calls, we have our peer support, our peer mentorship. We write articles together, we write blogs together, we organize this kind of webinars together. So I would love to invite everyone to join our community, and also to know that we are individuals, but we are also in the smallest units we're in. Our parents, our siblings, our classmates, our professors, start conversations, right? Let's talk to each other. Let's learn from each other. Let's introduce each other to new ideas. Try to identify our own biases. So we all have our little power and a little agency, and together we can, start talking about what's happening in the world and helping each other to learn and to do better. So that being said, I want to thank you everyone for joining us today, for taking your time to join this important discussion. Thank you to all our speakers for your time. I know how busy you are. And thank you to my team, CGHI, Yelena, our Vice President, and Mohammed, our Community Officer, and Rafa from IVPN, and all the technical team behind us. Thank you very much. Have a good evening. Let's keep in touch. Bye-bye.
Hi, thank you.